It just kept confirming this sense that, okay, somehow the environment is totally a blind spot in our profession. It's just like we don't think about it.
That's Filip, the founder and executive chair of the Environmental Physiotherapy Association, the first international network of over 1,200 physiotherapy clinicians, students, academic and professional representatives seeking to advance environmental awareness and responsibility across physiotherapy research, practice, and education.
I think getting people into those environments they need to and want to spend their time in, engage in those activities that to be engaged in that find meaningful are all things that we have talked about as physios for a long time. But for some reason, this idea of outdoors is too difficult or too distant, or it just hasn't been incorporated in the same way as those really fundamental functional tasks.
That is Jessica Stanhope. She is a research fellow in the School of Public Health at the University of Adelaide and chief medical scientist in the rheumatology unit at the Queen Elizabeth Hospital. Jess holds qualifications in physiotherapy, epidemiology, and public health. If there's one thing pain has taught us, it's that treatment must escape the four walls of our clinics and start focusing on durable changes in the context of people's lives.
I think that we really have to get over as a profession that, as you also said in your question, is, but people actually live out there. So why not move more of the treatment out there?
Research is being done that shows the environments that a person lives and functions in can have a significant impact on their health and well-being.
And one of the things that we found is that people who have a park within walking distance of their home are less likely to report they've been diagnosed with arthritis. They're less likely to report that they've had pain that's been moderate to very severe in the last 4 weeks, and less likely to report having pain that had a moderate to extreme impact on their lives in the last 4 weeks.
This episode will help you consider your patients' environments and help them make changes that persist outside the walls of your clinic. Thank you, as always, for spending some of your precious time on the podcast. I greatly appreciate it. If you feel like you've gotten any value from the podcast, I would love it if you could take time to review the podcast on your podcast provider so the message can reach more people who need to hear it. Now, on to the episode.
This is the Modern Pain Podcast with Marc Cardula.
Filip, let's start with you because you're the spearhead who's really gotten this thing off the ground, and it's a pretty impressive website with a lot of really impressive team members you have there going at the Environmental Physiotherapy Association. But I'd love to hear the story of where it all started.
This whole idea around environmental physiotherapy and what environmental physiotherapy might be actually was somewhat of a tangential outcome, I would say, for my PhD studies. So I was doing my PhD between 2011 to 2017 under the supervision of Professor David Nichols in New Zealand. And I was studying something, let's say, on the intersections of ethics and physiotherapy, a somewhat fringe philosophical perspective on ethics, looking at what that perspective might imply in terms of physiotherapy, like critiquing what we have today and what kind of otherwise visions maybe come out of that. And as I was working on that, I think one thing that became clear to me was that somehow the environment, however we might define that, was somewhat of a blind spot in how physiotherapy understands ethics and professional ethics and things like that. It just wasn't really there, wasn't mentioned. Professional ethics, generally speaking, are very much on the sort of behavioral codes side and not really like ethical theories in the stronger philosophical sense. And so with that, I noticed that blind spot, but it wasn't something that like heavily necessarily featured in my PhD. It was just something that was there, and it was then in the background of my head for quite a while. I was like, there's something going on there. And then after my PhD, I was really a little bit fed up with academia. I just wanted back into clinical practice and did that for a while. I think for about a year and a half, probably, I went back into clinical practice and found myself working in these clinical spaces in a somewhat large chain of multidisciplinary clinics in New Zealand at the time, where we had these treatment rooms that classically would have white walls all around, treatment table, a desk, a computer, and for what it's worth, also no access to natural light. So no windows, nothing of the sort. And I was just thinking, wow, something's up here. And to top that off, in one of those spaces, the clinic was actually 2 minutes away from a really beautiful beach in New Zealand. Just about any beach in New Zealand is beautiful. So I just Googled New Zealand and beach, and that's where I was close to. And I just thought, okay, it's really weird. Why do we think that people should come in here from there and get better in these odd spaces, these unnatural spaces, when they could just be outside there going for a lovely walk in the beach, whether in the sun or rain? And again, somehow, why are we not? Why is that not something we're doing something with? And so I ended up bringing like plants into my at the time like clinical spaces and pictures of the outdoors, and then people would come in, and that would be the first thing they would comment on is, oh wow, look at that picture and how beautiful that. And it just kept confirming this sense that, okay, somehow the environment is totally a blind spot in our profession. It's just like we don't think about it. And then the other thing, I suppose, was that I'm not sure how to formulate this in a positive way, but if you're following some of the environmental stuff going on in the world is going under. There's a lot of things going wrong, and that can leave you worrying. Look into it. And I think I found myself in that dilemma that's very common to a lot of people, that if you look at those things, you feel this very strong sense of overwhelm because climate change, global warming, biodiversity loss, etc. is like huge issues. And then I'm just one physio sitting in my clinic, and what in the world can I do? It doesn't even make a difference whatever I do. And so the place I found myself in was like, okay, so I can't, like what I'm doing alone just by myself, it doesn't do all that much. But then I can't also become like the president of the world and change everything. It's just not likely for my life's trajectory. And then I thought, okay, but maybe there's a middle ground here, because maybe I can do something in my profession, which has this blind spot, but consists of, let's say, around 2 million people worldwide, all of those underworld physio, but everyone around as well. And maybe we can do something in that profession, move 2 million people. And if you move 2 million people, maybe that does a difference and moves a few more and something like that. And so it was on the back of that, actually, I sat in a kind of cafe with Dave Nichols at one point, and we were just like jotting down some ideas and ended up writing this editorial that we published in mid-2019. And used the publication of that editorial to start the EPA, which has now been going for a little over 5 years.
Always interesting to hear the stories that bring it to fruition. Jessica, how did your journey? Yeah, the origin story for sure. How did your journey make your way over to this, Jessica, in your career? What was the parts of your journey that got you to focus in this kind of aspect of things?
Yeah, so it was never really something I was aware of as physio in terms of there being an evidence base around it, or even thought to look at it. But with patients, I would, similar to what Filip was saying, I would tell them to spend some time outdoors, go and do some gardening, go park. In a rehabilitation setting, I'd often take the patients outside and aim to try and rehabilitate them to a point where they were confident and safe outside, rather than often what happens, which walk up and down the hall safely, which isn't quite right. So I always had this kind of, approach that incorporated it, but without appreciating why, in terms of I would now conceptualize it. So about the same time the EPA started, a colleague came to me and suggested that we actually do a short opinion piece looking at green space exposure and pain. And their idea was that we have a fair bit of evidence around green space exposure improving mental health, and they're aware of the link between mental health and pain. And what was supposed to be a very easy kind of opinion piece turned into a much bigger job, because, of course, once we started thinking about that more, there were lots of ways that these were potentially linked, but not a lot of evidence. So this was all happening around the end of my PhD. I had a 6-month research position to get my head around what was there and what these theoretical links were. In the last few years, I've been trying to start actually getting some data, which is, of course, a slow process, but we're getting there. And so I became aware of the EPA once we'd published a paper that was hypothesizing this link exposure and pain outcomes, and Filip retweeted it. I became aware of the organisation because of that. So it was all happening around the same time.
Social media connecting more lives. It's interesting. I've established some similar relationships just through, again, a retweet or something random like that can start something pretty cool. I love the thought you both bring up, this like concept of considering the environment. And when we speak with chronic pain patients, and the thing that when we're mentoring clinicians, it's always like we try to treat people in this very sterile, white-walled, no-windowed environment. In some cases, I definitely have practiced in similar settings. Yet the people that we work with function outside of those four walls, where those environmental challenges and different things exist. I'm wondering if maybe both of you can speak to a little bit of how you see maybe a physio maybe having more purposeful consideration of environment in their practice, of where the patient functions outside the four walls of their clinic.
As I indicated, I've always tried to incorporate the environment without necessarily knowing why, and it was in some ways, a bit similar to what Filip was saying. I was frustrated spending so much time indoors as well. So some of it was actually me appreciating that if I had to be inside for 3 or 4 hours, the patients who were in there all the time, that was a really probably an unpleasant experience for them, particularly if they were people who were there to what had led to their rehabilitation stay, had spent a lot of time outdoors. And so I think we can do a lot more in terms of that rehabilitation side. So about a year or two ago, a colleague and I wrote an opinion piece linking this idea around there's a lot of complaining with COVID and lockdowns and quarantines and those kind of things, but identifying that for a lot of the patients that we see and a lot of more people in our population, that's what they often experience. Even if they're not in a nursing home or some institutional setting, if they're at home and they are not confident going outside, not able to do it by themselves, then that's what they face all the time. And so I think it's something that we've all had a bit of a taste of now in terms of kind of short-term exposure to that idea of being stuck indoors all the time. And so I think really use that experience to people appreciate why that is a problem. And particularly thinking about teaching students, it's a really nice example of what that means. And so I think getting people into those environments they need to and want to spend their time in, engaging those activities that to be engaged in, that find meaningful, are all things that we have talked about as physios for a long time, but for some reason this idea of outdoors too difficult or too distant, or it just hasn't been incorporated in the same way as those really fundamental functional tasks like being able to go to the bathroom and being able to make a cup of coffee and those kind of things. But it's really important for people's health and well-being that they do have access to the outdoors, that they do have access to green spaces. And so we can really start thinking about that, but not only just for our patients, also thinking about the broader community and making sure that they can access these spaces and get those health benefits as well.
Filip, I'm wondering if you can speak to that a little bit, because I love the idea of being more purposeful with considerations of the environment. And we're going to definitely dig deeper into that green space and pain, because I know you mentioned there's some good literature coming out on that topic. So we'll get back to that. But Filip, I'm wondering if you can speak to that a little bit.
I think there's one little bit fundamental thing is what do we actually mean by the environment? What's that term refer to? If I'm just to go back to this issue of where did this start from, for me it was a really very general question to begin with that started this thought for me, which is, well, what does physiotherapy have to do with the environment? Without necessarily having defined the environment all too specifically in asking that question just yet, right? So in some ways, thinking of both, if you will, natural environments, but also human-made and also social environments, et cetera, et cetera. So thinking environments in a little bit of a broader way. But of course, in today's world, there's very much also a reason to think about, especially those kind of what we call natural environments aspects, because of all the environmental issues in the world. And so that kind of has a little bit of a prominent space in what we're talking about. But at the same time, I think it's really worth, especially in this, in the context of what you're asking, how to be more purposeful around the environment, to think of the environment as this even broader category, right? And so, as in general, I think, I think it's known quite well that physiotherapists don't engage in people's life worlds and their living environments sufficiently, right? We don't visit people in homes in their homes enough. We don't check how elderly people cross the road and if it's safe to do so and all those things. We're not overly involved in things like universal design and so forth. There's a few of us doing bits and pieces in those kinds of spaces, but it's relatively limited for the most part. Somehow our profession is really deeply connected to these particular clinical spaces, right, that we have, these physiotherapy clinics, maybe hospitals, and then in those hospitals, the spaces that we use for our treatments. So by and large, from the start, we don't have a good sort of relationships to the environments that people actually live in, what you said in the beginning when you asked that question. So I think that's a starting point and some kind of a threshold, I think, that we really have to get over as a profession. That, as you also said in your question, is, but people actually live out there. So why not move more of the treatment out there, right? I think that's a really basic starting point, and being more purposeful about the environment also means that, okay, so have your patient in your clinic every once in a while, but talk to them about the world they live in, the environment they live in day to day, workplaces, the commute spaces and so forth, where they spend their leisure time, all of these kinds of things. if the regulatory frameworks around physiotherapy in your country allow it, go there, do something there with them. Maybe I think there are some legal questions in some countries also around this. But as much as you can, either go there or think your way there with your patient and make things relevant for their lives and the environments they live in. That's one starting point, I think. But then if you think about this kind of ecological thing, I think there's like these two sides. For one thing, we could think about how do we make our clinical spaces integrate like the environment a little bit more, simple things like plants, indoor plants and things that actually is relevant. And I think over time we'll also see more literature coming out on that. We've just, I think, I'm not sure if we've published it yet. Yeah, we've had a blog post come out on a physio clinician from Canada who was looking into literature around indoor plants and what that could mean for patients' health. It's super simple thing, but the point being, we just haven't reflected on it really. Do you have a window like in a hospital when you're in the when you have a window, we know that leads to people standing up more quickly, these kinds of things. So being more purposeful around what is actually the clinical space that I work in and how does it operate, right? But you can also think bigger then. Is that clinical space particularly wasteful? What is the environmental footprint of the clinical space that I'm working in? And are there ways to maybe reduce that? And so slowly you're looking at different ways to be purposeful around the environment, right? And then if that's happening in the clinical space, maybe there's also all this stuff going on like outside your clinical space where you can think about the environment in even different terms, bigger terms, like what Jess is alluding to with this green space stuff, nature-based therapies, health promotion, a lot of things in that direction. So I think there's this sort of range of things that we can look at if we're thinking about how to be more purposeful around the environment. It relates to our clinical spaces, our patients' lives, but then also some bigger kind of ecological and sustainability issues, if you will.
You think about the clinical settings that we often operate in, hospitals especially, where there's a lot of just sterile, sometimes intimidating things around that patients. And I know for a good portion of my career, I had zero consideration. I was just trying to keep my head above water to feel like I knew what I was doing. But I do think, ingraining this early on of physio's training of at least a consideration that this is part of the context you create in the clinic, right? And our context can really be powerfully, there's a lot of studies on contextual effects and things like that. But I'm wondering if you could speak to maybe a few things, but let's maybe start with the physiotherapy student training, because I know there's a big discussion of that on your website, and I agree. I think we need to understand and at least be considering this. And I think it opens up a whole new, and Filip rightfully points out there might be some legal issues in different areas, so that obviously make sure you're abiding by all your legal standards in whatever country you're operating in. But to me, it opens up a whole new area where we can really expand our practice into and probably help people where it matters most, and it's in their lives. It's not in, of course, it's helpful to help people within the four walls of the clinic, but man, if you can help them in a meaningful space that's meaningful in their life, it seems like it would be much more powerful. I'm wondering if maybe, Jessica, you can start with the physiotherapy training, where you see that as a necessary part of what we're trying to ingrain in our students.
Can I just jump in with one thing before Jess goes there? It's a little bit of a qualification on some of the stuff that we said before with our clinical spaces. It was really interesting. There's a colleague from the Caribbean reacted to this blog post that we recently put out about the indoor plants and said, that's how our clinics look. They're full of plants indoors and outdoors. They have like big open windows or doors. They're always open to the outside. So that's basically how we operate. And so I think we have to, the qualifier here is that some of the experience that the three of us are talking about are from our specific context. I've worked in Germany, New Zealand, now in Norway. Mark, you're in the US. Jess is in Australia. And so I think there's some similarities around how physiotherapy looks in those places. But I think we have to be conscious of also the fact that, hey, it will look differently in other countries and other places around the world that in some cases are way more ahead of our particular context when it comes to some of these specific things. So I just wanted to flag that as a little bit of a qualifier to the discussion before.
Yeah, that's a good point, especially in the U.S. where we have a very multicultural locations where we're seeing people who might have different conceptions of what their environmental space should or shouldn't look like and different things. So it's good considerations definitely to have as we're working with unique people. Jess, I'm wondering if you can speak to a little bit of what your thoughts are on that whole physiotherapy student training of where we feel like that needs to be at least minimally incorporated into what they're considering as they enter the profession.
I think it's really important, and I think it's not too difficult, just because if we go back to those fundamentals of what is already kind of conceptualised physio as and how do we normally do our clinical reasoning, is just about reframing that slightly. So things like the ICF framework, which at least some physio programs and the one I did uses as a fundamental framework for clinical reasoning, it has the environment in there. But when I was taught about it, we're only talking about kind of the home environment, the work environment, maybe the social environment. We weren't kind of thinking beyond that. So we weren't really thinking about where people spend their leisure time or that kind of bigger impact of the environment on their health and well-being. And so I think that's the tweak when we're thinking about it, just to prompt you to think about that. When we're talking about things like patient growth with a patient, going that you need to do, but what is it that you want to do and where do you want to do that? And I think that's something, reflecting on how I used to work as a physiotherapist, I wish I had better, because often I think we ask patients what their goals are and we just accept them at face value. But if it's something someone hasn't engaged in for 5 or 10 years, or they don't think they'll be able to engage in the future, then they might not mention that they want to go and do their gardening that they have done for years and has been really important to them. So I think building it into kind of those prompts around things like subjective assessment and things like that is really important. But I think it also, a big part of it is the kind of building this as being a legitimate part of practice. So we did a survey of allied health professionals in Australia a couple of years ago, and one of the big things that came out as being a challenge was this idea of it not necessarily being perceived by patients and clients and even by other health professionals as part of what we're doing. All elements of allied health match it perfectly. And so one of the two big recommendations going forward that came from the people who are involved in the survey themselves was that we need more research and we need more education, both of allied health professionals and of the general public. And I think this is a really lovely way of actually integrating that in a way that's not too difficult to actually get into the program. So it doesn't have to be a course or a whole semester on environmental allied health, although that would be wonderful. It's actually just integrating it throughout and getting those prompts along the way, I think is a really great way of doing that and normalising it as part of what we do, but we should be doing, and admittedly what we historically will. So the hospitals 50, 60, 100 years ago, typically a single story, really great connection with the outdoors, be able to easily wheel patients outdoors, and that's really shifted. So I think what Filip was describing in terms of clinics in the Caribbean, although they probably weren't quite as open and things like because of the weather, the settings we used to have were more like that. So it's going back to those basics and back to those fundamentals that I think is really key, and to highlight that is something that has been part of physiotherapy for a really long time. We just lost sight of it in this patch in the middle.
Filip, what are your thoughts around physiotherapy education as far as incorporation of this?
First of all, like from just speaking from a perspective of like our activities in the Environmental Physio Association, we've had this education project, international collaboration since early 2020. We started it just about as COVID hit Europe really clearly, and maybe started in spite of that. And I'm really, for one thing, I'm really fascinated by how much waves it has made and how it's gone around the world. We now have over 100 participating physiotherapy education institutions that are working with us to get these topics into physiotherapy training around the world. And for me, that actually means that, like, in some way, from a personal perspective, I think we crossed the threshold of a point where it's become clear that, yep, this is simply going to come into physiotherapy education curricula. It just might be the case that some might adopt this a little bit later, some a bit earlier. And then from the start also, we said, hey, in doing this, let's just keep it really open and not try and specify you have to do that and you have to have a special course here, like Jess was saying, but see what seems to feel right in your respective context, in your program. Where in the program do you think there is a small connection you can make to something topically? Start bringing in some little starting points, and then let's see where those are and build from there. And I think that for me, the segue in terms of content, that what we found is that the environment actually has something to do with just about every aspect of physiotherapy. Anything you can think of in physiotherapy somehow has something to do with whatever you might think of as the environment. And if that's the case, or given that's the case, you can make these connections explicit in any element of a physiotherapy training program, right? And that's from anatomy and physiology, because, hey, remember, we're breathing oxygen and we eat food, which is an environmental thing also, and it's related to our bodies. And there's some of these connections to all up the way to, for example, in Norway, part of the law for physiotherapy education is that in addition to all those like individual health and rehab things, we also have to teach on public health. And so, we also have to teach on social determinants, ecological determinants, sustainable development, sustainability, etc. So it just goes across the board in the curriculum. How much you put it, where, that might be an open question, but there's possibilities to do a little bit of something just about anywhere, and it's coming.
If you go to the website, there's some teaching prompts and there's some other resources. Well, there's a boatload of resources, actually, if anybody's looking to incorporate this into their curriculum. And I know they have some contact abilities, too, to the folks at the EPA that if you want to reach out, I know they have a ton of resources they can share to help you start incorporating it. So definitely reach out. And we'll link it in the show notes as far as the resources and articles and all that good stuff. You touched a little bit upon it, Filip, with the social determinants of health. That's one big thing that definitely impacts in my world, where we're working with a lot of persistent pain issues, but obviously it creates challenging environments for the people that are navigating some of the challenging issues around social determinants of health. I'm wondering if either you can discuss where you see these two intersecting with what we see clinically with patients, and probably not just obviously, I'm obviously biased towards the persistent pain patients, but whether it's a neurologic patient, a pediatric patient, and everything in between, there's going to be these components within their care. I'm wondering if you can speak to that intersection.
All right. For me, I think I just have to say a little bit, I feel in terms of my background, just positioning myself. So when I started working as a physio, I started working in a relatively standard sort of everyone's clinic in a neighborhood in Frankfurt in Germany. A little bit more maybe towards like sports physio, also musculoskeletal rehab in that space. And I eventually also went to do a master in also that space in New Zealand, but then found a way to go in a slightly different direction. So I am from a muscular background and kind of this fairly classical individual treatment type of physiotherapy. For me, the possibility that thinking environmental physiotherapy opens up is along the lines of what also I think a lot of people in our profession are, or more and more people in our profession are talking about now, is about how do we move away from this like exclusive focus on the individual towards a little bit this upstream thinking of how can we somehow contribute to more upstream levels of either number one in a kind of meso level in the individual's environment, but then also like further up at a kind of population health level, at the level of like ecological determinants, social determinants in general, and so on. So for me personally, thinking environment allows to make that connection precisely because the environment is everywhere in a person's life, but it's also such a kind of like supra category that you might as well just go there, right? Because it's a total like a kind of connecting thread. And so along those lines, I think like social determinants, ecological determinants, there's a number of different terms there. It's very much related to this sort of like thinking and moving upstream and thinking what might our practice be further upstream as physiotherapists. Yeah, I think this is a really like important element of the whole thing. So, yeah.
Jess, where do you see the social determinants intersecting with what you're all up to at the Environmental Physiotherapy Association?
Yeah, so the kind of environmental determinants and social determinants are quite linked. And I think as Filip's described, like environmental determinants kind of sit, I guess, above that. So it's another level of social determinants, but there is this pretty nice link between it. So a lot of my work is green space exposure and looking at health outcomes. And in that literature, there's evidence that if you've got green spaces in close proximity to your home, you're more likely to be integrated within your community. So more social interactions. You're less likely to have violence in your community, and kind of those elements will then influence people's health and well, really important. But I think if you go back to that thinking of vulnerable people who have to spend a lot of their time indoors and reflecting on COVID, in some parts of the world, that's where we're headed with climate change. So one of the big recommendations around managing climate change is instead of doing too much about reducing climate change, because it's quite difficult, obviously, is to ensure that people have secure energy supply, air conditioning and those kind of things. But of course, that means we're spending way more of our time indoors, interacting with others in the way that we normally would. So there's that influence as well. So They're just a couple of examples of how these things are linked. I guess a more positive in a way of kind of thinking about another example, though, is you have natural disasters, which are obviously terrible, and they can have huge impact on people's health and well-being, particularly mental health, and have those lasting impacts. But they also bring communities together. So I'm not saying that we need more natural disasters or anything like that, but it's just another way in which those things are linked, because they really can consolidate that community and gather on things that can reduce their risk. And some of that might be things like revegetating around waterways, where you can reduce the flood risk or whatever it might be. So I think there's a huge number of connections, and that's just a few examples.
Great examples. And you speak to a little bit of the climate change in Phoenix, Arizona, where I'm at. We're at 40 degrees Celsius still this time of year, which we're supposed to be cruising into winter, but hopefully we'll be cooling off a little bit. But it goes to, and I definitely see this with patients, where this is the time of year where everybody's socially isolated because nobody wants to be outside in the temperatures. And when I lived way up north in the US, it was the opposite. It was winter. It was like below zero significantly. So it's interesting to see some of those challenges that we all face climate-wise, as far as like maintaining that social kind of environmental connectedness.
Sorry, it's not just the social. On that note, just to jump in there, it's not just the social, right? Exactly what you're describing, whether it's like if you have these kind of heat waves and the likes, like we've also had throughout the summer here in Europe, it's not just that people don't have that social connection, but it has actually effects on physical activity as well, which a little bit closer to home, maybe to a lot of physios. It does have an effect. If you decide not to go out, that reduces how much you'll be moving around, what kind of movements you'll be doing throughout your day, et cetera, et cetera. So it's very like immediately on the physical also, if you feel like that's what you need to connect to it as a physical therapist.
Great points. Jess, you mentioned the study on green spaces and pain. Of course, we're going to want to talk about that on this podcast. I'm wondering if you could go in a little bit about what you found. You spoke to maybe a little bit about some of what you looked at, but I'd love if you could talk about that paper a little bit. I think it's soon to be published, if not published.
Yeah, so we've got a couple of papers that will hopefully be out by the end of the year. So one of the things that we're really fortunate to have available to us in Adelaide is a cohort data set that was established in 1999, and their last data collection point was 2015. And there's lots and lots of things that we can do with that in terms of using the satellite imagery and maps of public green spaces and biodiversity maps and things like that we will do down the track. But what we've actually done at this stage is use people's perceived green space exposure as a measure of their green space. So about 2008, they had one of their data collection points. They actually asked people about the features of the neighbourhood. And this was broader than green space and lift space and all of those things, more about the walkability of the area. But they had several questions that did relate to green space. And one of the things that we found is that people who have a park within walking distance of their home are less likely to report they've been diagnosed with arthritis. They're less likely to report that they've had pain that's been moderate to very severe in the last 4 weeks, and less likely to report having pain that had a moderate to extreme impact on their lives in the last 4 weeks. So it's still preliminary evidence that there's this link, and the next stages before we publish will then be unpacking why that might be, because we do have data on things like mental health and physical activity, social integration and sleep that we can then look at, and all of those things can be influenced by green space exposure. So we can then look at, is that the relationship, or is there something independent going on that might be explaining that, or a component of that? And I think with this, it really is, there'll be different components that are more important depending on what else is drives. So really exciting. We're starting to generate that evidence, but we've got some more work to do. But one of the things that we've been really interested in is this aerobiome diversity idea. So there's always microbes around us, and often we think about protecting ourselves from microbes, but there are good microbes around us as well. And microbiome, or gut microbiota in particular, has had a lot of attention in the last decade or so. And one of the ways we can influence that is through exposures, and that can be things that we ingest or that we inhale. And so we were thinking about this in terms of the aerobiome diversity for green spaces. So generally, if you have diversity in the environment, in terms of plants and animals and so forth, the aerobiome will have greater diversity. And then when you inhale that or ingest it because it's influenced the surfaces that you touch, then that can change your gut microbiome and then influence things like pain and stress. It's really difficult to assess in humans. So things like people's exposure to green space or having indoor plants can give us an indication, but we can't really narrow it down in the same way we can in animal models. So we have conducted a mouse study where we had mice that were 3 weeks old at the beginning of the experiment, so they're just being weaned, and then we exposed them to different aerobiota or diversity levels. So it's really trying to simulate spending time in an urban forest, spending time in more like a sports field or a less diverse public park, or an indoor environment, which is, of course, where a lot of kids spend most of their time. And we exposed them for 5 weeks before we started looking at their most offensive responses to different thresholds or stimuli. This is an indication of their pain levels. And we then injured the mice, so we did give them a sciatic nerve injury and then mapped what happened with their pain after that. And what we've demonstrated is that the mice that had the high diversity exposure, so what we would view as being more that forest environment growing up, had a higher pain threshold than the other two groups, and they recovered much more quickly from their sciatic nerve injury. So day one after the injury, they'd all decreased their thresholds in a similar way. By day 3, the high diversity group had returned to their baseline, whereas the others, they'd edged towards it, but they diverged again at day 14, which was the end of our experiment. And that's a really important point in terms of giving us some clues around chronic pain. And so these are really encouraging findings. It doesn't appear to be related to anxiety and stress in the mice because we've looked at those factors as well. So what we're doing at the moment is then look at the spinal cords and the dorsal root ganglia to try and explain what is the link in terms of, more from that physiological perspective, that might be able to explain that. And, of course, looking at the actual changes in the gut microbiome as well. And what's super exciting about this is if you have the green spaces that are diverse enough in the right locations, people don't necessarily change their behaviour to benefit. So from a public health perspective, where we don't have a lot of pain prevention approaches, it provides us with a unique opportunity. And of course, we've only looked at this in what would be considered early childhood through to early adulthood, but that tells us something about what we can do in childcare centres and schools where kids spend a lot of their time. And so we might not be able to get all the green spaces in the right patches around people's homes. We might not be able to get everyone to spend time with their kids in the forest because we just know that's not going to be possible for a lot of families. But if we can get the data into those areas they're already spending their time, then maybe we can reduce the burden of pain. And of course, we're then starting to think about what does this mean clinically once someone already has pain, particularly in adulthood where the microbiome changes might be harder to achieve. So there's a lot of really exciting opportunities in the future, I think. But I think for me, PhD in public health, although I'm a physio, kind of more public health at heart, I think there's massive that we can make in terms of people's environmental exposure and therefore their pain risk, even if it is down the track. So those kids having that early exposure, protecting them as adults if an injury, which at some point people are likely to have something going on. So, yeah, super exciting.
Absolutely. That definitely fascinating stuff going on. And I can see, and it makes me excited about the opportunities for future research to start exploring these things. It sure makes sense for some of the hyper urbanization where green spaces have gone away. And I know you speak to that a bit on the website and different things. Filip, I'm wondering, because I want to respect both your time. First off, I want to thank you for it because it's been a great discussion. I've enjoyed it. We could probably talk for about 2-3 more hours if it was up to me, but I know you all have lives and things outside of here. If we were to look in the future, Filip, with all the great work you all doing, what would you like to see as the ideal way this is incorporated into a physiotherapy practice? What do you envision? I know it sounds like you're obviously purposeful and you consider it on your own right now, but what would you look to see as like the ideal future scenarios of where this fits in with the big picture?
Yeah, so I think one thing that probably also needs to be said is that this is what we're doing is not a development in many ways that's exclusive to physiotherapy. Thinking about how the environment is related to health is happening all across the healthcare professions, public health, et cetera, et cetera. And so there are terms and emerging fields that are just about mushrooming at the moment that will be called planetary health, One Health, eco health, sustainable healthcare, and the likes. And there's a lot of thinking in all healthcare professions about what are the implications of those for the healthcare professions, but also how can the healthcare professions contribute to these developments at a time when basically it's recognized that we have to think health, environment, and society in an integrated way and no longer as isolated phenomena, right? So what we're doing is not unique. It's in that sense, it's just the uniqueness in what we're doing is maybe that we're thinking from a physio perspective, right? What does this mean for physio and what can we contribute to all of this? So that's one thing, right? So there's essentially a kind of really global movement and global development roughly in this bigger space of health, environment, and society. Now, if I think about physiotherapy specifically, for me, in some ways, the thing that fascinates me about this idea of environmental physiotherapy is that it has the potential to do all sorts of small tweaks to what we're already doing, right? Like we talked about, it's not a big tweak to have a few indoor plants in my clinic. I'm still doing what I'm doing. That's a small tweak, right? But it also has this potential for these bigger and bigger kind of tweaks of, I'm going to go out there and then I'm going to do this. And then suddenly I'm not working with my patients anymore. I'm actually working with urban design and with landscape architecture and God knows what. And then I'm working in another public health space. And so for me, the potential that lies in there is that, yes, it has this potential to make what we're already doing slightly different, slightly better, but still what we're doing. But it also has this potential of allowing us to completely dive into new space areas of practice, think about our responsibilities and therefore our practice in a new way, do completely different new things that we haven't done before, but that make total sense if you start thinking physiotherapy and the environment together. And I think that's where I'm probably most excited about. One of the things that we also only just started doing on our webpage is to try and in some ways project towards the future. What does this mean for practice? Both in terms of the small tweaks, but also in terms of the bigger stuff. And I think that's really a space that I'm excited developing of what can the new things be that might mean. Like in essence, I have to say that all physiotherapy is environmental physiotherapy already, because you can't think whatever we're doing, it's got something to do with the environment. But when you really think that, it just starts like opening up these opportunities, I think, and I'm really excited about developing those. I sometimes do that in very like specific and targeted ways and things that we can recognize, but I also have this engagement that I started with my students here at the university, UiT, the Arctic University of Norway, where in the context of my public health teaching, I've introduced something that I've initially called physiopunk, and now I'm referring to as health punk. I invite students to write fictional stories about a future in which physiotherapists no longer work with individual patients, but work directly on social and environmental issues. And I try to get them to paint those kinds of visions and ideas and so forth. And I'll try and close a little bit on this. Already in the first cohort that we had do this exam task, there was like 8 stories that we published in the first sort of physiopunk volume. In those 8 stories, there was a lot of stuff that when you read it, you thought this is just outlandish, totally crazy. And why would you even think that and encourage anyone to think it? The funny thing was that only a few months after those stories were written, about half of the things that were indicated in those stories came to life and to practice in some way or another. Like, yeah, I'll give you 2 examples. There was one student who wrote about how physiotherapists in the future might farm algae for both food, but also for carbon sequestration. So bringing down carbon into the earth. And 3 months later, I found out that we have a physiotherapist 3 hours from where I'm sitting that is farming algae for food for now. But anyway, like it's close, it's there, right? Like is a physiotherapist doing something completely different that somehow touches on what we're thinking about. Another student of mine wrote a story about how physiotherapists in the future would go on Arctic expeditions and work on the Arctic ice and so forth. And about 4 months later, I was invited on an Arctic expedition with our university's icebreaker to collaborate with some ecological scientists and think about what their work has to do with health and so on. So I think there's an amazing space for us to think totally new, totally different about our profession, do entirely new things, and therewith contribute to the health of people in completely new ways, but still contribute to the health of people, right?
Absolutely. And when it comes to pain, I think the research has been pretty clear. Like we need to move outside the 4 walls of our clinic if we're going to really make a significant impact in pain. And I think you nicely put, it's not just a physiotherapy thing either. This is I sometimes wonder how much the siloing of our professions into our little neat packages of what we do sometimes limits our ability to have the scope to really make the impact we want. So I think having some of these interdisciplinary groups and things to help us work together and maybe break down some of those silos will be huge. But again, we could talk for hours. I really appreciate you both. I really appreciate all the awesome work you're doing. Those of you listening, make sure you check out the show notes because we'll have links to all the resources, the website, and some articles that you can read to keep yourself up to it, and then maybe incorporate some of these environmental principles into your own practice and into your own community. So thank you both.
Thank you. It's been a great conversation.
Thanks for having us. Yeah.
All right. For those of you listening, if you could subscribe wherever you listen to the podcast, if you're watching on YouTube, we'd love if you could subscribe there. We'll leave it there this week. We'll talk to you all next week.